Welcome to HealthWatch, presented by Novant Health. I'm your host, June Baker. This show is all about exploring health topics that matter to you and your family. We appreciate the opportunity to introduce you to local physicians and health professionals who serve as our health experts. Today we are excited to welcome two guests. Our first guest is Michelle Sumrall, and she's the manager of Respiratory Services, Cardiac Rehabilitation Services, and Cardiovascular Diagnostics at Novant Health, Brunswick Medical Center. And then we'll meet Dr. Philip Kahn, a plastic surgeon with Novant Health Coastal Plastic Surgery located in Southport. So stay tuned to learn more on HealthWatch. Today, our first guest is Michelle Sumrall. She's the manager of Respiratory Services, Cardiac Rehabilitation Services, and Cardiovascular Diagnostics at Novant Health Brunswick Medical Center. Welcome to the show today, Michelle. I'm so happy you're here.
Thank you, June.
You have a lot of exciting news for us today.
We do. We have a lot of exciting things going on in the market.
But first, you have so many talents and you're involved in so many things. So give me your backstory on your 15 years at Novant Health.
So I'm very fortunate to be able to have been here as long as I have been and be able to treat so many community members. As you said, I am with respiratory, cardiovascular, and cardiac rehab, and they all intertwine at some point in time, which is wonderful to kind of see full circle, you know, all the things that our patients go through in their journey when they're here with us. And so all those things have helped me throughout the years take care of our community.
Mm-hmm. Did you start at that level, or did you start as a respiratory therapist?
I actually did start as a respiratory therapist here, PRN, when my kids were younger.
Wow.
Just worked when I could, and it worked for our schedule. And I was very fortunate to have a manager who wanted me to come on full time. I came on full time, and then I was her succession planning, and here we are.
And here we are today. So let's talk a little bit more in depth about all the services that you do manage. So let's start with respiratory services.
Mm-hmm. So we have an extensive team here for respiratory with lots of years of experience, some that surpass me, which I'm very fortunate to have those members on our team here to take care of our patients. We do everything from breathing treatments to running mechanical ventilation. As much of our audience will be aware, COVID, kind of brought us to the forefront as healthcare professionals, and this team did phenomenal work taking care of this community. So we're just very blessed here.
We are, absolutely. Well, okay, let's move on to cardiac rehab and diagnostics, and I know that you love this. What exactly does that involve, and how does that all work?
So both sides, cardiovascular, we see patients, we come in and, they're really coming in here to take pictures of their hearts, right? Hearts and how their heart's working, how all the pumps are working, making sure everything's working efficiently. And then on the cardiac rehab side, if those hearts aren't working efficiently, I may see them over there as well, and they get a referral to us for us to come and help, rehab them so that we can get their hearts working like they should. We work very close with the cardiologist in devising a treatment plan that works best for that patient and what they need in their plan of care. Our exercise physiologists, our nurses, our dietitians, we all holistically work together to take the best care of them and their heart and to get it back where it needs to be.
Okay. So a typical patient may have just had surgery, right? And that would be part of their recovery?
Exactly. So, a typical patient could go and have something like a stent placed in their heart or bypass surgery. After they are cleared by their provider, they will come to us, and in a 36-week sessions, we will take care of them and exercise, because exercise is one of the best medicines for any of us. and especially after you've had some type of surgery, especially dealing with the heart. And they will come to us and we will teach them things, how to eat. We even do yoga with our patients, relaxation. Stress, we know, is a leading cause of heart-related issues, and we teach them, de-escalation techniques and all those things.
Oh, wow. How about, are there many cardiac patients who need the rehab but have not had surgery? Is there a program for them?
There is. So we have congestive heart failure patients.
Okay.
Once we do an echocardiogram, that would be in my cardiovascular diagnostic service line. If their ejection fraction is low enough, they may not have ever had surgery. They will come to our cardiac rehab. We will work with them to try and get that, what we call ejection fraction up. And those patients, we keep them from, potentially having to have those surgeries. And that's the best part, is doing less invasive things to be able to take care of these patients so that they don't have to have those surgeries.
Well, tell me a little bit more about that 3-month specialized cardiac rehab program that we offer. You touched on dietary and many things. So who provides that? It's not the respiratory therapist, but you bring in other specialists, correct?
Absolutely. So like I said, we take a holistic approach to the patient. So we bring in dietitians, we have exercise physiologists, cardiac nurses. I will have yoga instructors also on the plan of care for these patients. And together, along with cardiologists, we will devise a plan, an exercise plan that is safe and most effective for the patient. And it just takes a holistic approach to, we have to look at their diet, we have to look at their behaviors, what are their stressors in their life that we can help them learn and identify so that we can make them feel better and get better after such a life-changing event.
Does it always last 36 weeks?
So it's not necessarily 36 weeks, there's 36 sessions.
Oh, 36 sessions.
Some patients can choose to come 2 days a week or 3 days a week. Most of our patients choose to come 3 days a week. And then we will, barring any absences from class or whatever, typically around 3 months we can get them in and out.
It seems like a long time, but it really isn't.
It's not.
Those go by pretty quickly, the 36 sessions.
Yeah, and our main goal is to teach them things so that they can continue that when they go home. Because an exercise regime should be part of their daily routine or, their lives so that they stay well.
Yeah, so it's a lifestyle change.
It's a lifestyle change.
Yeah. Well, there's a lot of excitement around here, so let's talk about that. Well, tell me about the new cardiac rehab space.
Yeah, so we're very fortunate. Like I said, there's a lot of interesting and fun changes coming to the market. We are going from a 900 square foot gym to a 4,000 square foot gym. Currently, right now, we can have 10 patients in a class. We're going to where we can have 16 patients in a class.
Wow, that's a huge.
We're getting so many referrals that we're booking out to May right now. And so this added space will allow our patients to have a bigger gym. There's a walking trail. We have what
There's
we call
a walking trail?
A walking track, I should say,
in the...
around our gym. We are going to have a Zoom room where we will do Mediterranean diet classes with our counterparts in Charlotte and Forsyth, so that.
And the Mediterranean diet seems to be a very heart-healthy diet.
Very heart-healthy, and teaching patients. We touched on that behavioral piece.
Yeah.
But teaching patients how to change their diet, but still be fulfilled with what they're eating, right?
Which you like, but...
Yeah, and so getting them to understand the Mediterranean diet and being able to wrap their heads around it. And so that Zoom room will allow them to, and allow us to utilize resources all over the market. So we'll be able to utilize resources from New Hanover, like I said, Forsyth and Presbyterian as well.
Yeah, that sounds wonderful. I'm curious, since COVID, have you seen an increase in enrollment in the rehab program?
So unfortunately, we have seen a lot of patients, of course, with breathing issues. For our rehab program right now, we haven't seen a lot of increase. We know the need is there, but because of our size, we haven't been able to take those patients on. When we move to the new space, we will be adding pulmonary rehab, And that's where we'll start seeing those patients, I think, more and getting those referrals, because there was a lot of injury to people's lungs. And right now, the closest pulmonary rehab is in Wilmington. And that's a far drive for our patients who really don't want to cross the bridge. And so part of our growth plan, once we get over there, is to add pulmonary rehab so that we can take care of those post-COVID patients a little bit better, because they are seeing lifelong issues with their lungs that we're finding.
Yeah.
And hearts too.
In the new space, where is cardiac rehab located in the new building?
So we're fortunate we got a premium spot on the first floor with lots of windows. Our old gym had no windows, and that was one of our patient complaints. So we have lots of beautiful sunlight coming in, lots of bright colors. We're in Suite 101, which is underneath of our cardiologists. So if we ever need them, we hit a button, it will alert them to come down to us, and they will come down and take care of, help us take care of the patient and let us know where we need to send them, if they can go home, and it's safe for them to just relax and calm down, or if we do need to proceed to the emergency room. Most of our patients are Novant Health heart and vascular patients already, so those providers know them. They know what they need, and they are the best ones to help us in those emergency situations. If it's a really bad emergency, of course we will call 911 and they will come. But we are very fortunate to have the cardiologist right upstairs.
And the Novant Health Heart and Vascular, they were formerly Cape Fear Heart, and so everybody knows Cape Fear Heart in our community. So that's really great that they're right upstairs.
Yes.
And that you have the ability to call them at a moment's notice.
We literally will just hit a button on the wall.
Wow.
It'll alert them, and they'll know where to come.
I cannot wait. I can't wait to see it.
Yes.
So, I heard something interesting, that you're the chair of the Election and Nominations Committee for the North Carolina Society for Respiratory Care. Tell me more about that. I know it's a nonprofit, correct?
It is. So I kind of got voluntold, but I always do all the things that will help, our career and professional growth. And so that is our state society for all things respiratory care, right? And so in order for us to stay on top of all the things that are coming out and the new guidelines, that's where it starts. And we really push for, scope of service for our RTs to practice, with autonomy. And we have a lot of autonomy here. And so I like being on that committee with the state society, just to know what's going on around the state, because that allows me to bring things back to our respiratory team that we can use here for our patients.
Yeah, it seems like it would be helpful in your job as a manager of all these different services, you would be on top of things and know things like before most people do.
Right.
So you can bring that back to your team. Well, Michelle, this has been such a great interview with you. I've learned so much, and there's just so much to share now, so many exciting things that we can all celebrate. Before we wrap up, how can people learn more about your services and what we have to offer here at Novant Health?
So of course we have our website, novanthealth.org, and you can find the cardiac rehab services on that site. Anybody is welcome to call me or call my team, and they are happy to answer any questions in the cardiac rehab, and that will help, let them know where they need to go, where to start.
Yeah. All right, Michelle, thank you so much for being here today. I look forward to having you back after we have some time with our new space, and tell us how it's going.
Absolutely. Thank you so much.
Thank you. Please welcome my next guest, Dr. Philip Kahn, who's a plastic surgeon with Novant Health Coastal Plastic Surgery, located in Southport. Welcome to the show. Welcome back to the show. I love when you're here.
Thank you very much. It's good to be here.
Yes. So we're going to jump right into it. And I know that you've told me and others that you were inspired to become a physician because of your dad and your mom. Your dad was a surgeon with Brunswick Community Hospital for a very long time, and your mother was a nurse. So tell me a little bit more about that. How did that affect you, and how in the world did you become a plastic surgeon?
It affected me really well in the fact that we're such a small community.
Right.
And it was a unique practice that they had, with Dad doing general surgery as well as general practitioner work. And it was really unique in that my mother was the RN and the nurse that ran the practice.
Yeah.
So I got the full scope of care and what they really provided, not only medically, but just as leadership roles in the community. And that really sort of molded me for wanting to kind of carry on that tradition and being embraced in the community. And it led me eventually to kind of forge my own path into plastic surgery, and allowed me to find a path to be able to be creative and provide similar types of care for patients, but just on a broader scale.
I knew your father fairly well. He used to come to lunch. The old hospital was located right across from his office, and I would see him every day at lunchtime. And he was a special man.
Yes.
He was a very special man, as is your mother. I mean, I know your mother, and I love seeing her around, and you had some great parents.
Absolutely.
Yeah.
Absolutely.
So let's talk a little bit about what your role as a plastic surgeon entails. A lot of people, when they think plastic surgery, they think just cosmetic surgery, but there's so much more to it.
Absolutely. You know, there's a lot of things that are much more than just the cosmetic focus that we have. We provide a wide variety of things, from skin cancer surgery to things such as basic hand surgery, on top of all the cosmetic things. And a big part of what we do are the reconstructive surgeries, whether that be for broken bones in the face, broken bones in the hands, or even things such as reconstruction for cancer, most commonly here, breast reconstruction. With that, there are also some things that patients feel that are cosmetic that are treated by us that can be helped as well, that are actually functional. The main thing here are women with large breasts that have had histories of neck pain, back pain, shoulder pain, that really they don't want to present sometimes because they don't want to get labeled as having a cosmetic procedure, but it's functional in nature. The others are things such as excess eyelid skin, droopy eyelids. That's a functional concern that can affect people's vision that we really treat quite frequently as well.
I know that there are so many people that have been affected in one way or another by breast cancer, and your work in reconstruction is so important to these women. So what about that, what makes that so meaningful to you?
To me, I think it really offers probably the highest honor a provider of any type of care, whether it be medical or whether it just be socially in general, to be selected by that patient to go on that journey with them. And it really touches the heart in doing that, because you present things, you say how you're going to reconstruct, but it's an honor to be chosen by that individual patient to say, not only am I taking this journey and my family are taking this journey, we're allowing you to be on this journey with us. And that provides energy for me to be able to focus and really just continue to provide that care for patients.
I'm going to be really honest here. I have been through that journey with you, and I found you to be my best friend during this whole process. And it is a very important role that you do play in that process. So I can attest to that. And it was obvious to me how meaningful it was to you, that you felt very special in being able to treat me. And I thank God every day that you were there. And I don't want to embarrass you, I'm just embarrassed myself. But
Absolutely, yes, ma'am.
So I know that you treat other areas. So tell us more in what situations you may play a role in plastic surgery that we may not immediately think of.
Very good. You know, a lot of things that we don't immediately think of are some basic hand surgery type things. Things like people that can have what we call trigger fingers, or even little lumps or bumps on their hands. We actually treat that. in this community, I do simple things in that area. And really, we have a lot of skin cancer treatments that we do. We don't necessarily do full body skin surveillance, but things that someone says this mole doesn't look right to us. Yeah. And really treating that cancer primarily and then reconstructing that or providing other care that needs to be done after that as well.
How does it make you feel practicing in a community where you grew up?
It's a circle of life, most definitely.
Yeah.
It's most definitely, and really blazing your own trail through that. I mean, my mom's still pretty prominent in providing care
She
still
sure
in the
is.
community. She's still going very strongly, but really means a lot being able to provide care for family members of patients that were my parents' patients. You know, some of them are in their 90s, and
Yeah.
I'm kind of coming back and I'm treating their grandchildren and great-grandchildren, and it really is, that's the most satisfying thing. And here it helps because I can do such a broad range. I don't have to be the eyelid surgeon, or I don't have to have a niche in something like breast reconstruction or just breast surgery. I have the full focus and can broaden anything that I want to do here.
Yeah, and I think that's very important, especially in a place like this, because it's just people from all walks of life.
Absolutely.
And have varying degrees of deformities or diseases or whatever. So you got a good cross-section here.
Across the board, yes.
So when we've talked about this in the past, how you prepare for a surgery. And so can kind of explain to our viewers the process that you go through prior to the surgery, which is a long process itself.
And I do this with every process because I believe in really pounding the basics of everything, hitting every checkpoint, and then all of your other creativity kind of falls into place. The process really begins after I've seen the patient and we come up with a plan of what type of the surgery is going to be and what type of reconstruction. Then it's exhaustive preparation, looking at photos, looking at measurements, and really understanding that each different patient has their own unique presentation. It's not all numbers based on a certain patient A reconstruction or certain patient B. And it's hours of preparation each weekend for the week ahead of, this is the type of implant I would like to use. These are the type of reconstructive procedures I'm going to use. And every plan A has a plan B, which has its own subset of plan A, B, and C as well. So it's a lot of things going through the head, but it starts with just having those basic steps, looking at the patient's medical history, looking at the patient's care that we're going to give in the operating room, but most importantly, preparing to look at how they're going to have aftercare. Are they going to, do they live alone? Are they going to do they have a lot of kids? Do they have a lot of dogs they've got to walk? Because we don't want them tripping over and falling, and those are all part of the process in the planning itself.
That's funny, I remember all those questions. All those. And speaking of questions, if somebody's contemplating having a plastic procedure, what kind of questions should they ask you? And on the other side, what questions do you ask them?
The main questions that they should start out with are, do we feel that they're a good candidate for surgery? Whether that's cosmetic, which is definitely because that's an elective procedure, or if they're healthy enough for the reconstruction that we're going to have. The other questions that are important are what things they can do ahead of time to help increase their chances of healing. And also what things they're going to need to be prepared for afterwards in terms of how long am I going to need someone with me at home? Am I staying overnight? Am I going home? But the most important thing that they should really ask is whether their plastic surgeon is board certified by the American Board of Plastic Surgery. And that is a big thing because there are a lot of various boards that aren't necessarily that board. And it's important that we underscore that because it's the pinnacle of patient safety and care, and it really helps us to become advocates for the patients. So
You're a very strong advocate for your
Absolutely.
patient. I can attest to that. I heard something the other day, I think I saw it on the news or something, about high impact exercise and how that can lead to aging skin. Is that really something?
I have to be honest in that I don't necessarily think that that's something. I think it may be something related to if this high impact is out in the sun with no sun protection.
So like a runner might.
Absolutely.
Because they're just in the sun all the time.
Absolutely.
Yeah,
And
that was kind of strange. And it had something to do with the gym, and I'm like, you're inside. What's going to happen?
absolutely.
You might break your ankle or something, but
I think it's a part of many different news outlets that are making things to where it might be that people just don't want to exercise really hard. With that though, and all joking aside, is that I really think it's important that moderation is the key to any of these things. It's just movement. Yeah. Movement is the first step to keeping someone young and healthy.
Okay, well, let's kind of switch gears and let's talk about product. If you would decide to have Botox or any of the fillers, is that a one and done process, or do you have to have it done over and over?
Typically, for instance, something such as Botox is something that needs to be treated roughly every 3 to 4 months for it to have an effect, because Botox is something that helps to paralyze certain areas of muscle so that we don't develop fine lines. Things such as fillers, which are things that help fill the skin, typically are ones that last about 9 to 12 months. So it's something that really helps, that you have to get repeated with time.
So it's an ongoing thing.
Ma'am.
And once you start it, you probably don't want to stop anyways. You probably
Quite
love
often,
your
but
product.
there are a few products that I think that with the more that you inject them and keep them consistently. For instance, something such as Botox, there are good studies and even my own analysis with our patients that sometimes it's not necessarily that definite every 3 months. It can get extended to 4 or 5. And many times less toxin needs to be used to create an effect.
Oh. Since the pandemic, when the pandemic hit, a lot of people went virtual for everything. And I think we continue now. We Zoom a lot. Did you see an increase in your patients, volume patients of people who didn't like what they looked like on screen?
You know, nationally, people saw quite a bit of changes with that. And we had actually begun to see that even before the pandemic, many years ago, because of phones and people looking down on their phones all of the time. So they noticed the skin of the chin sagging. But with the Zoom nation, I call it, you've seen a lot of different changes because people are focusing more on their face, but at the same time, the camera angles create a distortion that people aren't recognizing as well. Wow. So those are things that have really have become an uptick from this sort of Zoom nation, I call it.
Yeah. Tell me who would be a good patient for plastic surgery, for facial plastic surgery. Who is a good patient?
First and foremost, someone that's healthy and that can tolerate surgery. Second of all, someone who's willing to become a part of the team. Willing to be able to understand that there's a process that's involved and it's not a one and done type of, there are many appointments afterwards. Someone that's going to be able to take care of skin afterwards, and someone that's going to be able to help with the team create a plan so that they can best follow directions to increase their chance of care being what they want.
Well, I have so many more questions, but you're going to have to come back.
Absolutely. I would love to.
Thank you so much for being here again. We love having you, so let's get you back on the schedule.
Anytime. Thank you very much.
You're quite welcome. Thank you for tuning in to HealthWatch. I hope this information was beneficial for you and your family. If you need more information about services provided by Novant Health, please visit our website at novanthealth.org. See you next time on HealthWatch.